Acupuncture. Introduced to man thousands of years ago in the Eastern Hemisphere, a form of medicine predicated on internal balance to restore homeostasis within the human organism. In early times, nature introduced to man the understanding of yin and yang. From this unification of yin and yang came the sounds of the first human heartbeat. As the heart continued to beat, man became more aware of the importance of aligning themselves with nature. Whenever disequilibrium overcame the human organism, man would turn to acupuncture to restore balance. Fast forward to present. East meets West, and forth comes the advent of integrative acupuncture. Uniting the forces of Western medicine with Eastern medicine, here I stand. Just as it shall become yours, acupuncture has become my life. Let us begin.
Hello everyone, I'm Dr. Lott, your health and educator from Acupuncture is My Life. I'd like to say welcome back to my show. And on this episode, we're going to talk about the health benefits and the powerful combination of acupuncture and chiropractic care. Today I'm joined by my esteemed colleague, Dr. Wayne Burt. Now, Dr. Burt, I want you to tell my audience the benefits of chiropractic care.
I'd like to just thank Dr. Lott for having me on his show to talk about the benefits of chiropractic care. First, I'd like to explain a little bit what chiropractic care is. Chiropractic is the art and science of diagnosing and detecting misalignments in the spine. It could be in the cervical, thoracic, lumbar, or even the sacral areas of the spine. It is a chiropractor's job, and it is the only healing art that allows for us to try to improve and remove subluxations. And what a subluxation in the spine is the loss of motion and movement in the spinal segments. This loss of movement, besides causing pain, discomfort, can cause many different ailments in a patient. The chiropractor will use various methods to decrease the subluxation in the spine and then rehab the area around those subluxations. So in my office, when we're doing chiropractic care, there will be two parts to the care. The first part of the care might be where I'm using several physical therapies, possibly muscle stim, ultrasound, and massage therapy on the areas of pain and discomfort which are causing this subluxation to occur. With that, after we finish some of these therapies, which act as a precursor or a way of relaxing the body, we will then manually manipulate or use various other techniques in chiropractic care to help reduce and remove the subluxation. So many patients will ask me how I can determine or find a subluxation in the spine. And there are various ways we do that. One of the major ways that we find and discover subluxation is by the use of our hands, feeling, palpation. The others might be x-rays. And a third way may be even MRI. But for the most part, what we want to do is we want to find these subluxations and start treatment. And the treatment will be done by various methods. As I explained before, we may use manual manipulation and various different types of tables we have in the office to help reduce the problem. Many patients will ask me, what causes my back pain? There could be a lot of different reasons from back pain. One reason might be injury, workers' comp, car accidents, sports injuries, slip and falls. And another major cause that I found in my office that causes back pain is stress. Stress is a very big producer of back pain, especially in the upper back, neck, and cervical part of the spine. This stress causes muscle tension and tightness, and we need to reduce that muscle tension and tightness, and that's one of the reasons we use those physical therapies, and then we can mobilize the spine. In more extreme cases, sometimes with the subluxation process, we'll have a situation where the nerve that exits out of that area of the spine will get pinched or irritated. And in those cases, very often, the pain is much more severe. You might have situations where there's pain down the arm, numbness, tingling, pain down the leg with numbness and tingling. All those are signs that the nerve is being irritated, and that's part of, and very frequently part of, the subluxation process. The bone slightly may move out of place and then starts to irritate and press on the nerve. So with those things happening, there are very many different ways that we want to start to reduce that subluxation, and one of them will be, like I said, manual manipulation. Another way that we use a great deal in the office is what they call decompression, and we'll have a table in the office that we will have the patient lie down, and I'm able to slowly separate and decompress the spine to alleviate that nerve pressure. So for the most part, when I'm treating my patients, it's a combination of physical therapies using the stims and the ultrasounds and massage therapy and the manipulative process of a chiropractor to help relieve pain and symptoms.
Now, you know what I noticed, Dr. Burt, is a lot of people don't appreciate the overall effects of chiropractic care as well as acupuncture, because it's very important for the musculoskeletal structure to be properly aligned, especially the spine, in order to aid in the self-healing process. But what would you have to add to that?
Well, basically, that's what chiropractic was based on from the very beginning, is proper alignment of the spine. And in addition to that, when you speak about proper alignment of the spine, you also have to take into consideration the movement and motion of the spine.
Right.
Chiropractic care from its very beginnings and conception was that the spine needed to continue to move.
Right.
We have to have movement, and for a while in medicine, it used to be bed rest, don't move, rest the area. Mm-hmm. In the chiropractic philosophy, it was always movement must be restored to the spine. So not only movement, but proper movement and proper alignment is a key essential to health of the spine and the health of the body overall.
Now, we've worked together for some time. And patients that will come in with an assortment of issues, but the main focus would be, let's say, like lower back pain and upper back pain. Now, I know from an acupuncture approach, as I speak about in other episodes, I have to determine whether there's chi and blood stasis relative to a particular meridian, or if the pain is a result of trauma. And once I determine that, then I know how to put together a treatment protocol. But now, when it comes to chiropractic care, like, what is your approach, or how would you approach a patient that comes in to talk about lower back pain? They have issues of lower back pain.
Well, to be specific, lower back pain has a couple of different issues that can cause it. Like I mentioned earlier in the video, trauma, injury. But I do have a lot of people that come into my office and they'll say, I just started to get this back pain and I don't know what caused it. I didn't do anything. I bent over and picked up a pencil and all of a sudden my back froze. Generally speaking, I try to explain to my patients that wasn't the incident that caused the problem. There was probably prior things going on in your body, prior muscular tightness and issues that were going on for maybe years or months, maybe a prior injury many years ago, but that this pain that you're feeling now is a consequence of probably a decent amount of time. And with that, so we need to kind of feel and palpate as a chiropractor the musculature to determine how chronic or how much chronicity is in these muscles.
Right.
Is it something that's acute? Is it something that's chronic? And then from there, we would put a protocol of the certain therapies. It could be, as I mentioned before, muscle stim, ultrasound, massage therapy that we put in. And then I determine what the problem is by symptomatology, possibly x-rays and possibly even an MRI, how that spine is being affected. Is it compression? Is it rotation? There's many different things that could be different types of misalignment in the spine.
That's interesting. I mean, because like in working together, patients came to notice like how we bounce off of each other's diagnosis. And like he spoke about the chronicity aspect of it. Like, it's chronic. It's something that built up over time. I have to look into that particular meridian to see where it all started. And then I'll sit down and I'll speak to Dr. Burt and we'll come up with a game plan as to how we move about treating the patient. Like, he uses different tactics, stem, spinal manipulation and so forth, even massage therapy. Whereas me, I may do some sliding fire cupping, I may add moxibustion to really just vasodilate and get things moving in that particular area. But also, it depends on if it's as a result of trauma or just something long-term that built up. But now, we also deal with people with upper back, neck pain. And what's the approach that you take on that?
Well, I found that with upper back and neck pain, aside from cases of injury, that it seems like a lot of it's just a very stress-related area of the body. We have patients, we live in a day and age where so many of my patients will sit literally at a desk for 7, 8, maybe 9 hours a day at a computer terminal, not moving, just focused on that screen that's in front of them. It causes a lot of tension and stress in the muscles, and in my past experience, it's those patients that seem to have more neck and upper back problems than the laborer out there in the field that's actually using his body. So we really want to try to focus our areas on certain parts of the muscles of the upper back where it's a common spot to find trigger points, knots, rigidity, and then start breaking that down. And that's how we have found that maybe our care working together seems to be so effective. Some of the things I do as a chiropractor, some of the things he does as an acupuncturist, and some of the things we may do even ancillary to our care in the office, if it's our massage therapists, really helps to start to break down that musculature. The only other point that I find that we find a great deal with the neck area is because of all that tension and stress, I'll have a lot of patients that get headaches. We may have a lot of patients that have other symptomatology besides just neck pain. A lot of them will start to get radiculopathies, which are pain down the arm, numbness, tingling. All those things are from a buildup of enough stress and tension in the body and compression in that area to start to cause those more aggravating symptoms.
Wow, because it's interesting, you compare the office worker to the laborer out in the field or just out on the move. And it just reinforces what you said, the spine is designed for constant movement.
Exactly.
Constant movement. Now, an interesting question here is I notice when I speak to people is concern about manipulation or adjustments to the neck.
Correct.
Okay? And I joke around with them, oh, you're going to get your neck snapped or whatever, and they laugh or whatever, but that's very important. Now, this type of manipulation for a patient, how is that good for them?
Well, the idea of the spinal adjustment, be it in the neck, the low back, is to restore motion and movement. And it should be obviously very gentle, and it should be only done by, in my opinion, a chiropractor, because chiropractic is the only profession where we spend a good amount of our time in our education process to learn how to manipulate properly and when maybe not to manipulate. So there are various things that go into the decision making of manipulation. There is as patients get older, there will be a time when we may not use that form of manipulation, and there's other ways of restoring motion in the spine. There's other ways of getting around and getting the same results with those patients that we may not be able to manipulate.
Okay. Well, I hope that my audience was able to grasp some of this information, and you can contact Dr. Wayne Bird if you ever decide you need adjustment or he can benefit you as well. But I'd like to say thank you for coming on my show.
My pleasure, and I thank you for having me.
I enjoy working with you. What I must add to our discussion, both mine and Dr. Wayne Bird's, is that when it comes to acupuncture and chiropractic care, there's absolutely no pain medication needed. And that's actually a great thing in light of the present day opioid crisis that's happening now. So think about it, acupuncture and chiropractic care for pain management. But I will say, don't forget to subscribe to my show, and always remember, acupuncture is my life. What's yours? Acupuncture is my life.